Well, thank you all for joining us. We had we have people from around the world with us today, which is really, really cool. We have a couple participants, or at least one person from Poland, and people across the United States. And I know that we've had a couple people respond from Brazil and Australia as well. So it's really inspiring to me to see everyone here join us and be so interested in learning more about exercise, and something that I'm very passionate about, how exercise can help individuals with MSA. So just a really quick intro about myself. I'm a neuro exercise specialist and founder of Movement Revolution. And I've been doing adaptive exercise for people with neurological conditions for the past 11 years, and have had the opportunity to work with people at various levels and various diagnoses. And one of the things that I'm very passionate about is helping individuals with movement-related disorders realize the benefits of exercise. I devoted my career to providing community-based exercise programs to help everyone live better with their condition, and that's what I want to share with all of you guys today. So what we're going to have, I'm going to go through the presentation, and then we'll have a moment at the end for questions. So we can either type those questions in the chat box, or you can, if anyone knows how to, I don't know if, once we get into it, we can maybe raise hands and stuff like that. But we can kind of get into any questions at the end. All right. So I'm going to go ahead and I'm going to share my screen with you guys. I'll bring up the presentation. Bear with me one moment. I had some issues last time with the volume not working, so I just want to make sure that I can try to get that to work for you guys today. Okay, here we go. All right, so let's get started. So again, this is a part of a three-part series that we're doing on exercise and atypical Parkinsonisms. Today, obviously, our discussion is on multiple systems atrophy, and we'll kind of get into what an exercise program looks like. The big goal for me for these webinars is to, yes, give you guys as much information and tips on how to become more active, particularly in the home, especially with the climate that we're in right now. A lot of us are stuck at home and not able to get out and do all the things we typically like to do with regard to exercise. So hopefully give you some of those tips. But at the end, I'd like to have your feedback and answer as many questions as I can for you guys to help you out the best I can. So our mission here at Movement Revolution is to empower people with neurological conditions to live stronger every day. And that means not just for the hour you're in a session with us or in a class on Zoom, or we are very passionate about making sure that we're helping everyone live stronger when they're not working with us. That's the most important piece, is being able to translate exercise into daily function and realize the benefits of that exercise and the things that you have to do on a day-to-day basis. So that's our mission. That's what we're really passionate about. We've now been doing this a little more virtually over the course of the past 2 months, and I'll kind of explain what those resources look like here at the end of the presentation. But I didn't want to spend too much time on this. I'd really like to spend a ton of time on content and exercise itself. But I wanted to go over a quick overview for those of you who might be new to MSA or recently diagnosed, or just finding out more information on it. I want to make sure we cover as much as possible. We call this a webinar for atypical Parkinsonisms, and that's kind of a blanket term for conditions such as MSA and PSP and Lewy body dementia. But within MSA itself, there are two different classifications or types that we look at, and cerebellar is one of them, and then Parkinsonian is another. And you may have common symptoms, and it may be a combination of both of these different conditions, but sometimes individuals experience one type of symptoms more than another. The bottom line is, with everything that I say today, is everyone is different. As I'm sure a lot of you know and have experienced in talking with other individuals, everyone is different. So everyone experiences these things at a different pace, or maybe not at all. But with cerebellar, it typically involves more postural instability or lack of motor control of the upper and the lower extremity. So when walking, coordinating the arm swing along with taking the gait steps, or when walking, being able to lift and drive that leg up as big as the other side. One side might be a little bit more affected than the other. And along with that gait involves a wide stance and kind of that side-to-side rocking motion as you walk. The Parkinsonian is obviously these symptoms are very typical to somebody with idiopathic Parkinson's disease. And I know a lot of our clients here, maybe some of you, may have been diagnosed with Parkinson's disease first, and then maybe later diagnosed with MSA. But these are the common symptoms that kind of associated with more individuals with MSA being slowness and stiffness. And I think those are the big things that we address and we tackle first and foremost with any exercise program. But that stiffness also makes it difficulty with bending the arms and the legs, and obviously affects posture, which can, all of these things can affect balance and falls. But again, everyone's a little bit different, so you might not experience any of these things yet, or you might not experience any of them at all. But kind of just an overview of some of the symptoms. It is a progressive neurological condition, and it sometimes affects the autonomic nervous system as well, such as blood pressure and heart rate, temperature regulation, digestion, urination, and these are all things that we need to be aware of, and you should be aware of when exercising at home, and realizing, hey, when I stand up too quickly, or when I go to get out of the bed in the morning, I'm feeling really lightheaded and dizzy. And when I go to stand up, I'm feeling really dizzy and lightheaded. And that's due to blood pressure and a lot of these autonomic responses that your body does, and MSA does affect those. So being aware of that is really important. And then knowing how to navigate around those on a day-to-day basis and make sure they don't become as much of an issue is really important as well. You might not have this. It's not in all cases, again. So, as I mentioned before, each person is a little bit different. But the underlying factor is there's typically a poor response to pharmaceutical treatments. A lot of times MSA is diagnosed after someone is not responding to typical Parkinson's dopamine drugs, and that's when the diagnosis kind of comes in. But the one thing that's really important is that if the drugs are not quite as responsive, guess what is? Movement. And exercise is certainly, I am a strong believer that exercise is medicine, and it can help. And there's some research that we'll go over here in a minute that has been recently looking at that, which is really great. So there is limited research out there. In doing literature reviews, over the past few years, and kind of putting together information for our clients and our staff here, there hasn't been a ton of literature or solid research on looking at exercise when it comes to MSA specifically. But one thing we do know is that MSA is a Parkinsonism, or similar to Parkinson's disease. It affects the same parts of the brain, and it affects the motor fluctuations of the disease in a very similar way. So and there's some studies that have recently looked at how effective the similar exercise modalities are for people with MSA and compared to people with Parkinson's disease. And the same benefits have been shown to be beneficial. So the main thing is it's a movement disorder, and in order to fight it, we got to move. And certainly that's something we're really passionate about. This research that's recently come out, and actually the MSA Coalition has some great resources that I can share with you guys after our webinar today, along with the recording of this. Some great research that's come out within the past year that has looked at gait training, strength, and mobility to help improve gait and performance with MSA. So this study that was done across a few different sites over in Europe was looking at different physiotherapy or exercise or physical therapy options to help improve gait, stride, and stability. The interesting thing was, the one limitation with this study is that it was only 6 weeks long, and it had 10 people with MSA, 10 people with Parkinson's disease, and the Parkinson's disease folks were the control. But it looked at doing a very specific exercise program that involved basic strength training, range of motion, stretching exercises, and it was done 5 days a week with an individual, and then people were sent home with an exercise program to do as homework exercise to follow up with. And what was really interesting to me is that very focused, very regular, very intense exercise where you're working with someone, whether it be a physical therapist or an exercise professional, that's guiding you through that exercise, that has shown to be significantly more beneficial than after someone had gone home to do things on their own. Now, we're going to be talking about home exercise today. So this is something I'm really passionate about, and giving you guys the tools and hopefully as much information to skew those results, right? We want people to be more successful when they go home and they're working out together, or you're going to the gym and you're exercising. Knowing what to do and how to do it is step number one, and then executing it is the hardest part. That's step number two. But this study had shown significant improvements in stride length, balance. Over the course of the 6-week study, there were no falls reported amongst the 10 people with MSA, which is fantastic. And the gains in the stride length and gait speed and balance had sustained themselves over the course of the study until people went home. That the results kind of tapered off a little bit. So the key underlying factor of the study is do it regularly and don't stop. Essentially, is to kind of boil it down. But great research that shows, hey, exercise can help. It does help maintain strength, maintain stability if it can be done regularly. So that's exciting. And hopefully this research article will help spur a lot more going forward here. So, the one thing I like to talk about and touch on is to, really, advocate for everyone to build your expert care team. I'm an exercise specialist. I know a lot about community-based exercise, but I kind of look at this as your team, right? Your doctor is kind of the head coach, and they're kind of, getting all the right pieces in place and kind of giving you, hopefully giving you the right information to manage your disease process better. But all of these individuals can help in a myriad of symptoms that you might experience. So I highly suggest is finding a movement disorder specialist. If you have a general neurologist and you like them, that's great. Having that good relationship with your doctor is first and foremost, but a movement disorder specialist is going to really be up to speed on the research and the latest treatment protocols to help you manage your disease better. And then finding other clinicians that specialize in neurological conditions. That's one reason why I am very focused on helping individuals with neurological conditions, because I think it really needs to be centered and focused on knowing exactly how we design exercise programs for you. And that the same thing goes for knowing how to manage, the effects of day-to-day life. And that comes into play with occupational therapy, with buttoning buttons and getting out of bed and toileting and maybe, discussing speech and swallowing. There are specific things to neurological conditions, and MSA in particular, that a specialized speech therapist can help you with. So each of these coaches have a unique role, and I find myself and our coaches here a very unique responsibility, even more so than physical therapists. We kind of pick up where physical therapy leaves off, and we have the ability to see all of our clients and interact with everyone on an ongoing basis. There's no limitation on, how many Medicare dollars I have left, or how many reimbursement, or how many sessions I'm going to have reimbursed by my insurance company. Granted, we are private pay services, but the services tend to be a little bit more affordable than going to a physical therapist ongoing. But, we see a lot of our clients 2, 3, 5 times a week, and that gives us a really unique insight into your health and wellness. And communicating amongst this whole team is probably the most important piece, is making sure that we are communicating with your doctor and we are communicating with your speech therapist. And if you're working with other people within this team, everyone should be communicating with one another to make sure that while each of us have our own unique roles, we need to collaborate to make sure that we're doing our best job for you. You are the center of all of this. So that's what's really, really important. I think the really interesting thing now with the pandemic that's out there, it's forced a lot of us to be in touch just like this, and virtual telehealth and teleexercise resources that gives us the opportunity to hopefully reach specialized professionals, even if you live hundreds of thousands of miles away. It presents a lot of opportunities. So I wanted to go through some of the essentials with exercise for MSA to start off with. I consider exercise an inclusive treatment opportunity, meaning that it can help on a variety of different levels. We looked at all of those symptoms that typically associate with someone with MSA, and exercise can really help if done correctly and customized to what you need to work on the most. It can really help cover a lot of those symptoms. We just need to make sure that we target them correctly. The earlier you start, the better. That's the biggest thing. If you haven't been active with an exercise routine, it's never too late to start. I'm a firm believer that no matter if you're recently diagnosed, you've been diagnosed for 2 to 3 years, or you've been diagnosed for 5 to 7 years, there's always something that we can work on to help you become stronger, move better, and feel better throughout the day. The main goal, I'd say, with any exercise program is to, first and foremost, maintain mobility. The rigidity and the tightness that often presents with MSA is something that is going to take a daily stretch routine to really get that into place, to keep your muscles as loose and as mobile as possible. If you think about how, if you have a really tight part of your body, how easy is it to move that muscle? And what tends to happen is, as that rigidity and the tightness form, it doesn't allow the rest of your muscles to move as big or as dynamically, and that makes it harder to build strength. And with limited mobility and a decrease in strength, that's certainly going to impact your balance. So we want to work on all of those factors with your exercise program, but this is the main key things. Another thing is use personal assistance, walking aids, harnesses when necessary to make sure that you're maximizing what you do when you're doing it. There's a quote that says, if it doesn't challenge you, it doesn't change you. And I'm a firm believer in that. And we have a lot of resources here. Very fortunate to have a lot of resources here at our facilities here in Chicago, with body weight support harnesses to prevent people from going and falling to the floor. And I think, a lot of times that fear of falling or that fear of balance inhibits a lot of motion and a lot of movement, and it makes people apprehensive to do more. And it's important to acknowledge that fear, right? But then find ways to get yourself into places and positions and ways to exercise where you can minimize that risk, kind of build the confidence up, and that way you can make improvements going forward. So a couple of pictures here on this screen show the body weight support harnesses that we have in our gyms to help people, eliminate that fear of falling. A couple of people in here have, one of these individuals has MSA, and we put them in the harness and we do a lot of various overground balancing exercises. Again, challenging that balance, challenging the footwork as much as possible. And the study that I just referenced before that looked at the importance of strength training, mobility, the cardiovascular exercises they did was actually treadmill training. And for a lot of individuals, walking on a treadmill is difficult. Balancing while walking on a treadmill is difficult. So one of the things that they did in the study was body weight support treadmill training or harnessed treadmill training. So we have a harness here similar to what you see in the upper right corner of this picture, where we can train with people on a treadmill and make sure you're not going to lose your balance. But prioritize all of these things, but strength and mobility really helps build stability. So making sure that we're paying attention to that and limiting those fall risks as much as possible. So utilizing those assistive devices when necessary to make sure that you can get the most out of your movement when you're doing it. So as symptoms or ability levels change, your routine should change as well, right? We work with a lot of people that are very set in their homework routines. And one of the first things I do when somebody comes to me from physical therapy, many times it's probably not the first time you've been in physical therapy, you have a stack of exercises and a list of like 20 different things that you've done for the past 3 to 10 years. And it's hard to weed through a lot of those things to know what's going to be best for you right now. And that's the really important piece, is knowing where your abilities are now and focusing on what are going to be the best exercises that are going to help me tackle my symptoms right now, and tackle those most severe symptoms first. If you know, balance is one thing that you struggle with the most, well, what's the root cause of that balance, and how do we find that? And the way to do that is to get back in touch with those professionals that can help you by you know, doing an assessment to kind of assess, you know, is it a flexibility issue that's not allowing your muscles to move as big? Here are some stretching exercises to do. And then you build the strength on top of that. So building that customized plan and managing the progression of that plan, the intensity level and the complexity is all unique to you. And so I can't stress that enough, but I'll give you some general tools today on what you can do to be a little bit more active. I say your home is the perfect functional training gym. It shouldn't be your only outlet for exercise, but right now, sometimes it certainly is for most of us. So hopefully, the tools you learn today can help you with that. But the big thing, again, kind of reiterating back to our mission, it's all about how you can move better and feel better while you're at home, and no better time now than to practice exercising while you're there. Just a couple tips on how to make it a little bit more engaging and successful would be to limit the distractions as much as possible. Find a quiet place to practice. If you're going to be outside, a great way, as the weather gets warmer here in Chicago, it's just starting to get there. But getting out to the backyard, walking outside, walking places that you enjoy walking in and being active in are great places to do that. But try not to go at the busiest times of the day. Saturday mornings is probably not the best time to be going out for a walk in the botanical garden, but I think finding those locations that you really like to exercise in or like to be in is just going to help you adhere to that program much, much more. If you're working with someone, make sure you like that person, enjoy spending time with them, so that you're more prone to continue to go and work with them. Another great way is, engage other family members to exercise with you, or with your the person that you live with and care for. Engaging other family members too, it just changes things up a little bit. And I know sometimes the relationship between, you're working out with a spouse or a care partner for a long period of time, you're working out with anybody for a long period of time, you're going to kind of have some friction from time to time. So changing up is never a bad thing. So I'm going to play this video. I played this in my last presentation last week on PSP. The sound wasn't working all that well, so please, if you can't hear it, let me know. Raise your hand in the chat or mention it in the chat, and I will try to fix it. But I'll get it started here. Hope you can hear it. All right, so here is an ideal home setup to become more active at home and to help a loved one be more active at home as well. So a couple of good places that we recommend that you do these exercises would be either from the bedside, lying down on the bed, or in a chair, preferably with arms. So hopefully these are all things that you have around the house. And I wanted to quickly go through some of these tools that we suggest that are going to help elicit better movement while at home. So on the bedside, we have a wedge here, which just helps support the lower back if hip range of motion and low back pain is a bit of an issue, and getting up from a low surface is an issue in core strength. This is a great thing to have. If you don't have a wedge, you can pile up 3-4 pillows back behind you. It's going to effectively work in a similar fashion. But this can help just place, if you're sitting at the edge of the bed, place it behind the person's back. The tighter toward your hips that wedge is placed, the more support and the higher up it's going to give you that support. And you can do things like sit-ups from here, right? Of course, strength is something where you're working on sit-ups, or hip mobility, lying back and stretching out. Those hip flexors are great tools that you can use that wedge for. Aside from that, a dowel This is a PVC pipe that I have here. That's ideal. A wooden dowel works effectively the same. I know a lot of stores are closed right now and none of us want to get out. So even a broomstick is going to be very helpful. And if you're doing any, this serves multiple purposes, but if you're doing anything where, you're placing that stick out in front of you, make sure if it's a broom that the handle, the top handle of the broom is the object on the floor, not the broom itself. So when you go to do any standing and balancing exercises, that's a little bit more sturdy and solid for you to be utilizing. But other than that, you can use this for range of motion exercises. One arm tends to be a little bit tighter than the other, one side tends to function a little bit better than the other, and using a fixed stick such as this will help with eliciting more range of motion and allowing the person to utilize both sides of the body, hopefully evenly, as you're looking to gain more range of motion with the given exercise. Similarly, you can use a band or like a belt, like I have here. You can either double it up. This forces someone to utilize their own strength to maintain tension on that strap. So it's a good way to help be more aware or draw awareness to creating tension and strengthening the muscles. But sometimes, if it's loose, it's not going to give you the same benefit that the dowel would be. So just another tool that you can use there. Dumbbells. If you don't have these laying around the house, some people do, but if you don't, you can use soup cans, just anything to add resistance really for any kind of postural strengthening, lateral raises out to the side or reaching down to the floor and up overhead, things of that nature you can use some added weight for. And lastly would be a TheraBand. Okay, you can use any color. It all depends on the strength of the individual that you're working with. But a couple tips on these: we've tied a couple knots on the end of each end of the band here, which gives you something to hold on to, right? Gives them something to pinch with their fingers, or prevents that hand from kind of sliding out like that. If there's a big knot on the end of it, that's just going to help with grip strength. Or you can kind of tie the two loops at the end of each one. So. One last thing with the chair, if there's a chair and you want to do any standing and balancing exercises from the bedside, the nice thing about doing that is if you were to lose your balance going backward, you have a bed to sit down on, so it's going to be a lot safer. But when you're standing as well, that chair gives you a nice firm surface to kind of hold on to and stand up with, to work on balance and stepping exercises, so on and so forth. So that's a quick home setup that we recommend, and some different tools that we use with all of our clients virtually that hopefully will help you as well. Thanks. All right, so that was a great home setup, and hopefully gives you guys some good tips and tools to equip yourself with at home. So I hope that that was a little bit helpful. I know it's kind of a struggle with a lot of our clients as we try to be more active at home. Like, where is the best place to exercise? And certainly, if there's someone with more of a balance concern, doing a lot of those exercises at the bedside is great. But just making sure wherever you are, wherever you're doing those movements, you have enough space to move, and you have all the tools necessary to help elicit the best motion and keep you safe. This is just a general key components to exercise with this should say MSA. I'm not sure why I changed it, but apparently it didn't change on the slide, so I apologize. But it's a lot of things that we mentioned before. So the big things we want to focus on are gait, strength, and mobility. We want to do this regularly, 5 to 7 days a week. Find a routine that you do on a regular basis, and I'll kind of get into the regularity and the recommended amount of each different types of exercise here in the next slide or two. But find a routine that's going to be regularly scheduled, and schedule it throughout the week. Adapt and be innovative. Make sure that as you change, things change, and change up your routine, and finding new ways and to elicit similar emotions is really important and helpful to keep people adhering to it. Make sure whatever you're doing, we're progressing safely and slowly. If right now you're not doing any exercise at all, you're not going to be, I don't recommend going up to, 2 hours a day, 5 days a week. You have to build up your endurance slowly, monitoring your symptoms and monitoring your energy levels as you do that, monitoring your aches and pains and how the muscles respond to it. Another thing that I like to do is, find exercises that are measurable for you. I mean, we all like to see gains when we're doing something, right? And finding ways to kind of capture how am I getting better? I think doing something without any kind of measurable result or measurable benchmark is kind of tough for somebody to adhere with. So doing something as simple as how many times can you stand up and down from your chair in 1 minute today? Do that, and then practice that throughout the week, and then come back to it 2 weeks from now and see how many you can do 2 weeks from now. And seeing that progress and seeing that measurable progress is really, really important to help keep people engaged, so on and so forth. And one of the things that I love to do is not just work the muscles, but integrate visual and speech exercises along with other exercises. If you guys have gone through all these different therapies and you have that book of exercises, there are great ways to integrate your speech therapy exercises with your physical therapy exercises. And visual and eye tracking helps with balance and coordination as well. So integrating all of those factors together is really helpful to kind of help consolidate some of those workout routines that everyone has throughout the day. So exercise modes and frequency. So I broke this up into things that we suggest doing every day or components of every day, and then things that are a little bit more rigorous that you can be doing 2 to 4 days a week. A lot of the research that's looked at Parkinson's specifically, so idiopathic Parkinson's disease, is really focused right now on vigorous and intense exercise. That research has not been looked at specifically with MSA yet, but I think that there is something to making sure that when there's a lot of principles to exercise and the physiological changes in the mind and the body that come along with exercise for general populations as well as special populations. But all of the research shows that when you are exercising, a rigorous workout 2 to 4 days a week is important. So we'll kind of go through that in a minute. But the things that we can do on an everyday basis, again, stretching, mobility, flexibility work, yoga and Tai Chi are a great practice to help the mind-body connection and making you more aware of how your body is moving. And that has a lot to do with how flexible and mobile you are. And a lot of those practices have very slow, controlled motions that really lengthen the muscles out, which is a great thing to do on a daily basis. Low to moderate cardiovascular exercise, getting out and going for a walk, maneuvering around the house. If it's difficult for you to get outside and go for a walk, find a route within your house and do laps and count those laps throughout the day to see how many laps you can track, and just making sure you're getting those steps in to help that functional ambulation throughout the day. And if it's really difficult for you or someone to walk right now, focus on what are the home mobility things that are going to be the most challenging for me. Is it getting up and down out of my favorite chair? Is it getting up from the dinner table? Is it getting out of a wheelchair? Is it getting out of the car? Doing things those exercises will get the heart rate up as well, but that also comes into our basic functional strength exercises that are going to help you do your day-to-day functions much, much better. Sit and stands out of a chair, bridges from the bed. It's kind of in a workout here that we'll explain here in a couple minutes, but from those speech and voice exercises can be done on a daily basis. OT-related exercises, same thing. The muscles of your voice, the muscles in your hands and your fingers are just like every other muscle in your body. The problem is they're much, much smaller. And those muscles tend to, fatigue a lot faster, get tighter a little bit easier, and we don't isolate them the same way we do those larger muscle groups of your glutes and your hamstrings and your quadriceps that you need to ambulate and stand throughout the day. So focusing on some of those other methods of exercise that might not seem quite as intense is a great way to kind of add them into things that you do on a regular basis. But when it comes to more vigorous exercise, and vigorous can be on a variety of different scales. It can be cardiovascular exercise. So if you have a recumbent bike at home, tracking and knowing how fast you're going on that bike is one way to be very aware of the intensity level of what you're doing. So track the RPMs, the revolutions per minute there's been some research in Parkinson's disease specifically that's looked at vigorous intensive cycling, and that study had looked at cyclists that had maintained 90 to 100 revolutions per minute or above for at least 3 days a week over the course of, I think it was a 10-week or 12-week study, had shown significant improvements in gait, balance, and mobility. So translating that, it can translate from a bicycle or a new step, that does translate over into functional gait training as well. If any of you have an access to a new step or a seated recumbent stepping machine, again, that tracks steps per minute or METs and how hard you're working. Those are ways to track the intensity level. And I recommend, doing that vigorous exercise where you're a little breathless, you're sweating, you're feeling like you're moving really, really hard 2 to 4 days a week. And again, if you're not doing that right now and it's hard for you to achieve those levels of intensity, work your way up to it or go in short bursts. Do interval-based training, and be happy to help provide some guidance on that outside of this session if you have any questions on it. But then intensity or more vigorous exercise also applies to balance and skill-based exercises. So oftentimes, we tackle this in some of the classes that we have or personal training sessions where we're doing things with you that you're not comfortable doing at home every day. And if you're participating in physical therapy or exercise one-on-one training or classes, you should be doing things that you're not going to be comfortable doing on your own, right? Because you have someone there working with you. That's the time to really challenge your balance and your agility and your strength to make those meaningful adaptations to your body. So one of the techniques that I like to use and I give all of my clients to work on is what I call movement calibration. And this is something that you can do at home throughout the day. And the whole goal of this is to improve the daily function around your house. A lot of times we cue clients, and I hear family members cueing our clients or physical therapists saying, take a bigger step, right? Let's just do this a little bit faster, go faster, move bigger, big step. Well, those are very generic cues. They're very generic terms. And if you hear them, they might work for the first, year, month, and then you get tired of hearing it after time. So it's kind of hard to quantify what a big step or moving faster feels like. So this technique is meant to kind of solve that issue. So one thing that I recommend is to find a place in your home that you commonly have to navigate throughout the day. Going from your favorite chair to the dinner table, going from your bedroom to the bathroom. The bathroom is a really common area that falls tend to occur. So maximizing or making your movements more efficient and going to those areas and making your movements more efficient in those areas that cause you to be a little bit more unstable is really important. This is a great technique to help you do that. Oftentimes, if your steps become short or small, that means your feet are coming closer together, and that tends to tip your balance forward or backward. And doing this exercise on a regular basis can really help you at least be more aware to help reduce that from happening going forward. But essentially, you start at point A, you start at your bed, and you're walking to the toilet. And you count the total number of steps it takes you to get from your bed to the toilet. And then on the way back, I want you to count again. And the goal would be to decrease the number of steps that you take by X, 1 or 2 steps, right? And you go back to the bed and you do it again and say, okay, I think I can, you watch your steps. Let's see if we can make those steps a little bit bigger. So I want you to decrease your steps now by 2 steps and get to the toilet. And the whole goal there is to make symmetrical, big, controlled steps with a wide base of support that helps you ambulate more safely and a little bit bigger and better. And the same goes for anywhere around your house. I would suggest starting with a small distance and then gradually working into a bigger, more complex distance. Oftentimes navigating between couches, around ottomans, through tight spaces is difficult. And as you get better with those steps in this technique, you can start to integrate some of those things into your practice as well. So this is a workout routine that I put together just a little demo for MSA. It's about 10 minutes. So, you know, the big thing is always being aware of what your physical limitations are with any kind of exercise routine. Shouldn't be pushing through any aches and pains. You know, although muscles are tight, you know, if it's an acute joint pain where it's really sharp, try not to push through that. You know, improving, there's a lot of ways to stretch your muscles. There's a lot of ways to condition your muscles. And I'm confident that we can find a way to do those things without causing significant pain. And the trick that I use in doing that is saying, if it's painful now, and on a pain scale from 0 to 10, it's like a 4 to a 6, but then it goes away after we're done, it's probably pretty safe to work through. But if you're feeling it an hour after you exercise, or a day after you exercise, or 2 days after you exercise, you might want to taper down that motion or try to find a new movement that's not going to cause that same kind of pain. And one thing I'd say is any kind of standing, balancing, walking, and you have trouble with balance or have a history of falls, always have a gait belt on you. It's a quick, easy thing to find on Amazon. They're literally $6 or $7 to $9. If you're walking with someone, that someone can hold on to that gait belt and ensure your safety and that you're not going to take a spill. But here we go. I'll play the video for you, and we can discuss at the end. Hey everyone, the following is an exercise demonstration for individuals with multiple systems atrophy. All of these exercises can be done at the home and really is focused on daily functional exercise that's going to help maintain mobility, strength, and stability of the joints most commonly affected by MSA. So one of the things I notice first and foremost with all of our clients is that the muscles of the hips and the trunk tend to be very rigid and tight, which tend to impede ambulation and balance. So we're going to target those first and foremost. The side of the bed is one of the best places you can do this from a strengthening standpoint, and offers a lot of versatility for some stretching exercises. So if you have a wedge, that's a great tool to have around the house. You can put that right behind the individual, make them scoot forward right at the edge of the bed here. And then you're going to go ahead and lean back. If you don't have a wedge, a group of pillows would work, just stacked up behind your back, just to ease some of the pressure on the low back. What you're going to do from here is drop one leg down, and the higher the bed, the more intense you're going to feel the stretch. But you're going to bring one knee up towards your chest. And if that's hard for you to maintain on your own, you can always have a family member or a care partner kind of pushing up on this leg and driving that knee up and in, which helps a lot with hip flexion, which is one of the things we work on, but also hip extension and opening up the hip flexor muscle as well as the quadricep really helps open this muscle. That's probably my favorite stretch. It's called the Thomas stretch. You know, what I always suggest is holding these for about 3 to 5 deep breaths on each side. And when one side is a little bit tighter than the other, make sure you go back through and you redo that side that's a little bit tighter 2 to 3 more times than you do on the opposing side. You just want to limit those asymmetries as much as possible. So repeat that a couple times on each side as necessary. All right. Now the next one would be lying down in bed. And I know getting in a position to lie down in bed is often difficult. So let's target that first by figuring out how to get onto the bed. So sitting down at the edge of the table or the edge of the bed, you're going to dip one elbow down and try to use the opposite side of your obliques here to pull yourself back up nice and tall. Pinch those shoulder blades back, and then go down to the opposite side. Feel a nice stretch on the bottom side, and use these muscles to pull yourself back up as you go from side to side. Now here, we can take one arm and either reach it up toward the sky to increase range of motion with the stretch. If that's too tough on the shoulder, you can just take that elbow up. Okay, as you go from one side, squeeze those shoulder blades back in between, and then go over to the opposite side, taking that elbow down, hand up, or elbow up. Okay. A lot of times I see our clients, you know, if you have a favorite chair, you're in a fixed position, or the rigidity is affecting one side more, it kind of pulls you into these stooped postural positions, and that's why this lateral trunk mobility is really important to maintain. And it's the first thing you have to do to get yourself out of bed, into bed. You're going to dip that shoulder down, and at the same time swing those legs up and over. So on 3, I'm going to dip my shoulder down and pull my knees up to my chest. 1, 2, 3, down and up. and then just kind of roll onto your back. Now we're in a great position to do a lot of different exercises. So again, trunk rotation and trunk mobility is a really difficult thing for people with MSA to fight, and it's just that trunk rigidity that tends to get really, really, really tight. So with knees bent, you're going to take both knees over to one side, and I always stress to get that posture opened up as much as possible, to stretch out the chest and the shoulders. And you take this from one side, and again, whatever side is a little bit tighter, you want to stretch that side out 2 to 3 more times on the side that is feeling a little bit more tension. You should feel this in the low back, maybe down through the hips, up in the chest and the shoulders as well. Again, repeating that as many times as necessary from side to side. I would say no less than 3 times on each side. But then that transitions really well into a good active trunk rotation exercise, and it's more of a mobility exercise. Taking one hand, and I always cue people to look at that hand, and I want you to take this hand and clap it and sweep it and punch it over to the other hand. Okay, if that doesn't work, you always cue to kind of punch the wall as well. 1, 2, 3, roll and punch. Taking one hand over to the opposite hand, and then you're going to watch that hand and pull it back. Okay, notice how my knees kind of automatically come with me as I go from one side all the way to the other. Make sure you have enough room at the edge of the bed so the person's not going to roll off. Okay, and in a way to address that bed mobility, I often hear our clients say, I just can't get farther over in the bed, so I just sit there on the edge of the bed, and sometimes that leads to falls off the bed, which we don't want. So let's do a bridge. Okay, so you're going to bend both knees up. You're going to push through your feet, driving those hips as high as you can toward the sky, even if you're only getting a couple inches off the mat or off the bed. Okay, every little bit helps. Okay, so what you're going to do is drive up, pause, and then come back down. This is also great exercise. It's going to help you get up and off the bed or up and out of a chair much, much easier. The stronger your glutes and those hips are, the better you can be mobile in bed and as you go up to stand. Okay, and as you do some hip mobility work, it's a bridge up, and you just kind of scoot, okay, from one side of the bed to the other side. Okay, and now you're here. We're going to put all these exercises together. All right, they all work together. I want you to punch and roll. You're going to rotate the knees over to the right, and you're going to punch with that left hand over to the right hand. And as soon as we get already all the way over to the side of the bed, we're going to sit up. Ready? 1, 2, 3, roll, punch, and now we're up at the side of the bed. Obviously, it's not that easy for everyone, and it takes practice, but it's one of the most functional things that's going to help get your day started on a positive note. Now that we're at the edge of the bed, let's just do a few floor power-ups, okay? A little nod to Parkinson's Wellness Recovery with their power-up, okay? Great functional exercise that really works at getting hip range of motion. Those hips, again, tend to become really tight, and when you're limited in this motion here, okay, it tends to be very difficult to get yourself up and out of the chair. And when you're here, make sure those feet are tucked back. We want to kind of relate everything that we're doing here, okay, to what you have to do when you go to stand up. So big wide base of support, feet tucked underneath you, reach down, hold it there if you need to, power back up nice and tall. And on this one, we're going to go to power up. So it's a combination of that forward lean and a bridge all in one motion. Reaching down, bridge up, nice and tall. Okay, finish tall top. I always keep people to look up at the ceiling as they go to stand, because if that head's forward, the head is down, which is often a common thing that people with MSA struggle with. Having the eyes gaze, giving them a target to look at as you go to stand up really helps kind of get those eyes up and get that body weight a little bit more forward, okay? I see a lot of times when people go to stand, they fall right back into the seat. A lot of the rigidity and the tremors and maybe the ataxia kind of sets in. Those muscles are kind of bouncing you kind of back in your heels and you fall back. As you go to bridge up, and the more you practice that bridge, the more you're going to feel confident to really drive those hips up and prevent that motion from getting back into the seat. So again, all of these exercises work together. And it's just a matter of piecing them together and knowing what you need to work on the most to target that particular exercise. One last thing, I have a step over here. This is one thing that you could use. If it's hard to, you could use this as a stair at the house. If you're doing it at the side of the bed, you can just stack up a bunch of books. Very similar thing, but what we're really going for with this exercise is ankle mobility. So we've loosened up the hips, we've loosened up the trunk and the rotation muscles, but the first thing that hits the floor when you go to walk is your ankles. So we want them to be as mobile as possible as you go to take that first step. So if you have a stair at home, obviously you have to go away from the bed in order to do this. But you can kind of step up onto that step with one foot and then kind of lunge that foot forward. And what that does is it creates more range of motion in your ankle joint here that has to flex as you go to take a step forward. I often see, a lot of clients having a really difficult time. They just kind of shift back and forth with really tight, rigid legs. Well, that's because those ankles and the hips become so tight. The more you loosen those up, the better they're going to be. So you can either put the foot up there and just do a little calf stretch like so, or you can go into a full step, which obviously is going to be a little more difficult on balance. Make sure you have something to hold on to, 2 banisters, or just simply do it off the side of the bed, stretching out the calf there. But hope these are some good basic exercises that you guys can go take home. And if you have any questions, feel free to give us a call here at Movement Revolution, 312-465-3921. Have a great day. All right, so I hope that was a good idea of some things you can do at home to help you move and function a little bit better. But I wanted to provide some resources for you guys too, or at least a location for resources. I am happy to attach and link any resources necessary to help you guys be as active as possible following this presentation. So feel free to shoot me an email, but I will follow up with a recording of the presentation along with a great resource that was sent to me by the MSA Coalition on a study where they looked at home physiotherapy exercises specifically for individuals with MSA, and it's a great template with pictures and explanations on basic exercises that is available on their website. That is something that they can that you can access at home on the MSA Coalition website. Cure PSP is another organization that has a lot of resources for people with atypical Parkinsonisms, support groups, and so on and so forth. And then, we are a resource for you as well. Since the coronavirus pandemic, our mission has been to continue to provide resources for people to remain active inside their homes. So we have exercise classes that we host each and every week. Every Tuesday, Thursday. I just taught one earlier today, and then every Saturday as well. And those are resources for all neurological conditions. So it's not specific to MSA, but we try to give adaptations and modifications for every ability level, both seated and standing. Some floor exercises as well. I'm so happy to help provide some of those for you. But just a few more. This is just kind of an idea of some of the programs that we offer here at Movement Revolution. I think one of the things that I can't stress enough is the importance of getting a very customized wellness evaluation for yourself. So when you're starting up any kind of exercise routine, making sure that you have, hold on one second. Making sure that you have a roadmap to what you need to work on the most is really, really important. Let's see here. So getting that roadmap down is really, really important. One of the things that we do is the Zoom individualized training. I have a client that I work with. I might be on the webinar here today. That I work with down in Florida. Had the opportunity to connect with a lot of people across the country here in the U.S. To help them become more active, especially now during this time where you might not be able to access your traditional physical therapy programs or exercise facilities. So we're here to help. And again, we have videos online, some general, again, more stretching exercises, seated strengthening things that I can share with you all as well. The biggest thing is I want to make sure that we can be a resource for you. We hopefully can provide all the resources necessary for you guys to remain active. And our whole WebEd series is part of a grant that we received from the Parkinson's Foundation. We call it the Parkinson's Co-op. And it was a grant, an initiative that we set forth on to provide people with Parkinson's and Parkinson's-like conditions and atypical Parkinsonisms to become more active, to get educated on why they should be active, in other wellness routines as well, and other aspects of wellness such as diet and nutrition. Be socially engaged like we were in the beginning of this webinar. Everyone kind of connecting and communicating with one another, I think, is a huge, huge thing that helps keep this community strong. And you guys can all rally around one another, and we're happy to help coach that, facilitate that. We also provide some financial support for grants for exercise programs as well. But if you have any questions, this is my contact information directly, so you can feel free to contact me. You can reach us at any of our locations here in Chicago by dialing the phone number there. We are in the midst of redoing our website, so we'll have a new website out there probably within the next 2 weeks. So if you've been to our website, check back in and it'll have more resources and probably a little more concise information within the next couple of weeks. So with that, I'd like to kind of open it up for questions. Let me see if there's any in the chat here really quick. Let's see. I don't see any questions in the chat. So if you do have a question, feel free to type it into the chat box, and I can go ahead and answer those for you. I think it's probably the easier way to go. I see Linda has a question. So she has a question about walking through fatigue. So, what I often see with a lot of our clients is there's certain parts of the day where you're feeling better than others, right? If you've had a busy day and at the end of the day you're feeling a little bit more fatigued, I think that one of the big things to focus on, and the one thing I'd recommend, is to always make sure that you have proper assisted devices to help manage your fatigue better and manage your balance, to kind of eliminate any risk associated with working through fatigue. Give yourselves the opportunity to maximize that as much as you can. And I apologize, I thought it said walking, it says working, but working through the fatigue. And I think there's always going to be a threshold. So if your current routine, and a lot of times sleep and quality of sleep has a lot to do with this as well, so a variety of factors that could be playing into the fatigue, and depending on what that is, it probably changed my answer a little bit. But here, let me, it has to unshare my screen. I can definitely do that. There we go. So, working through and finding, getting a routine down where it's not going to cause you excessive fatigue is important. And I think the more consistent you can be with some of those routines, and finding small things to do each and every day and just gradually building in on that to see if that can help you manage your fatigue better, I think that's a great way to do it. Any other questions? That's a good question from Donna. What is the best method of communication between all your support partners, your entire team of care? I think I consider your coach to be your doctor, your movement disorder specialist. And the big thing is, a lot of healthcare systems, if you're working within the same healthcare system, are able to kind of share notes and look at the notes that you've worked on in physical therapy, and that communication should be pretty integrated. But if you're feeling like they're not communicating with one another, I always strive for our patients, or our clients, to be as much of an advocate for yourself as humanly possible. Making sure that you're asking your doctor those questions, and if you feel like they're not communicating with the other clinicians that you're working with, say, hey, have you caught up with my PT, and could you contact that person? And I know that in even working with a lot of different doctors here in Chicago, some are better than others at collaborating and connecting. But one of the things that we try to do for all of our clients is provide a note summarizing our assessment and kind of what we go through, what we've gone through, kind of what our goals are, to help provide that to you, and also we can fax it over to the doctor as just kind of a status update. But that line of communication, especially from different healthcare systems, can be a little bit tricky. But hopefully those might be some good tips. But above all else, I think, when in doubt, ask and try to be your biggest advocate to facilitate that line of communication. Any other questions? Well, if you guys are asking any questions, feel free to continue to type them in the chat box. I will unmute everyone as well. First and foremost, one of the things that I'd really like to do is thank the MSA Coalition. They help provide a lot of resources for me in preparing for this presentation and sharing the information about this. So I really appreciate that. They're a great resource that I highly recommend everyone look into. And I can help share some of those resources as we go. But I see Belinda has a question. Would you like to ask your question, Belinda?
Yes. Can you hear me?
I can, yes.
Okay. I'm not sure about the working through fatigue that Linda was referring. I have muscle fatigue with exertion. So it's not that I'm not sleeping well or that I am tired. It's after 1 to 3 minutes of walking with the rollator, my legs become shaky and start to spasm. And then at that point, I fall, or they just stop, and I can't move.
Yeah, that's a great point. I appreciate the clarification on that. I can certainly speak to that. I think, one of the things that I would certainly recommend is going into the walk, making sure that you establish that good stretching routine first and foremost. Because one of the things that I see, if you try to move a really, really tight muscle, as in going through a walk for a prolonged period of time, you're really fighting a lot of that rigidity and that tightness throughout the course of your walk. So that could contribute to a little bit of it, of your body's working incredibly hard to take a step just to fight the rigidity of those muscles. So maybe try stretching a little bit beforehand, before you go for a walk. But if you've done that and you've tried that, another way to do it is to, try to find a way to find some basic strengthening exercises to kind of progressively build up your strength and your stamina within the legs. There are some things, in terms of like rigidity and spasticity and just general fatigue that are sometimes hard to fight through. But with some progressive muscular strengthening, I think that's a way that you might be able to build on some of that endurance a little bit and fight that fatigue a little bit more. That's just a couple suggestions.
Thank you.
Yeah. Does anybody else have any questions?
Yeah, do you have videos that are available for actual stretching exercises?
Yes. So I will share with you guys a link that's on our website, on our virtual website it's kind of a makeshift virtual website that has some different stretching routines on there. So I will share that with you guys following up today's webinar.
Thank you.
Yep. Any other questions?
This is Pam from the MSA Coalition. I just want to thank you, Eric. This was an excellent presentation, and thanks so much for including the information that I had sent you. That was actually a surprise, and it was wonderful to see. Yes,
well, I tell you, I'm honored to do it, and I am very excited to see the research. One of the researchers I know pretty well. He's done a lot of research on movement-related disorders and exercise. And I'm excited to see research like that coming about. So I think everything that the MSA Coalition does to help fund that and support that research. I've seen the benefits of exercise firsthand with a lot of our clients living with MSA, and the more research that's out there, the more we can find resources to help all of you guys live stronger. So
when you say benefits, are you talking about mortality or morbidity or endurance or postponing the inevitable, or what is it, the benefit?
So the benefits of exercise are vast, right? So we could go on for days on what those benefits are, but I think specifically to MSA, the things that we focus on are improving current mobility, improving current function, keeping you doing the things that you enjoy doing as best you can, as long as you can. So when I talk about the benefits of exercise or the goals of an exercise routine, the way that we relate that back is to help find out what that means for each individual person, right? How can we help you feel better, function better, move better? What are the things that are going to give you benefit, right? Because inevitably we want to see benefit from anything that we participate in, but also, you know, maintaining too. You know, I think that's a big thing is maintaining where you currently are. If nothing else, maintain your mobility, maintain your strength. But that level of benefit is going to be different and feel different for every person. Any other questions? Well, thank you guys very much for being here with me today. I appreciate you guys being here from across the world, which is pretty neat. So I hope you guys have a great day. Again, I will post this and send this out to everyone in an email following up today's presentation. And if there's anything that I can do to help you or your family members going forward, please don't hesitate to get in contact with us. So thank you all. Have a great day. Stay healthy out there. Stay safe. And we'll hopefully talk to you guys soon. Have a great one.
Thank you.
Bye-bye.